their hands, I'd like to acknowledge all their hard work. And the ladies of my committee, the Education Committee, if you'll raise your hand, thank you for what you've done for this. At the end of each of the approximately 5-minute presentations, there will be an opportunity for you to ask questions. So I hope each of you will stay just a minute and ask for questions from the group. And then at the end, if somebody's thought of a question that they didn't think of asking while the presenter was up here, I hope that you will then take that opportunity to ask questions. I'll come back at the end, and if you have questions, please don't hesitate to ask at that time. I hope all the presenters have a list, and we'll go in the order that you're on this sheet, which is first the Judge C. Hickey Center for Alzheimer's Care. Next, Christ Community Health Services Augusta. Next, the Family Promise of Augusta, which was formerly known as Interfaith Hospitality. The Heritage Academy of Augusta. Rachel Longstreet Foundation, which was formerly the Jesse Norman School of the Arts. Rape Crisis and Sexual Assault Services, University Health Services, Inc., and the Salvation Army Augusta Area Command, Augusta, Georgia. So unless y'all have changed the order, which is fine with me, if you'll come up in that order. Thanks.
Good afternoon. My name is Jan Wiggins, and I am the president of the board of directors of the Judge C. Hickey Center for Alzheimer's Care. And we're just delighted, absolutely delighted to be here, and so humbled that we are one of the 7 grant finalists that you have chosen to reach out to, and thank you so much. I'm humbled to be with the other groups that are here today. They just do such tremendous work in our community, and thank you so much. The Judge C. Hickey Center is a nonprofit organization offering comprehensive adult daycare and in-home respite care services to individuals with Alzheimer's and a related dementia. And our mission is very simple. I always say it's very powerful. It is to provide the much-needed relief for the caregiver by providing a very safe and nurturing and loving environment for their loved one, so they can go about their daily lives, whether it will be working or running errands or going to doctor's appointments. It's so important. It's just providing some relief to them of the very much increased responsibilities of caregiving. And secondly, our mission is to keep the client functioning as independently as possible for as long as possible and with dignity. That's very important, and I think that's just so special about our organization. And our programs are designed to encourage participation in the decision-making process and promote self-esteem and encourages the independence of each participant in our organization. And the activities include music therapy and art therapy and pet therapy, which is so important. We have a wide range of motion exercises, reminiscent games and activities, and we celebrate all the holidays and special occasions and just have a wonderful time with the clients that are there on a daily basis. And all activities, of course, are designed to the current level of functioning of the client, because one of our main goals is that they just have a terrific day while they're there. And we are not a clinic. We are very much a social model environment there, and one of our goals is really just to help delay or deter the need for expensive nursing home care as long as we possibly can, and to keep the individual as functioning as independently as possible for as long as possible. It's truly a special place. It really is. And with over 14,000 individuals in the CSRA diagnosed with Alzheimer's disease or related dementia, and those numbers growing, this is certainly a wonderful resource in this community that a lot of communities do not have. So we're very fortunate to be able to have these folks there. The majority of our clients at the Day Center are women, and we applied for this grant, of course, in support of our financial assistance program, specifically for the women that we serve there. Since state funds don't cover all the full cost of the services that we provide at the Day Center, clients are charged a service fee based on their income. And as you can imagine, many of the clients that we serve are at a stage in their life where they are either on fixed incomes or limited incomes, and unfortunately many of the women are either at or below the stated poverty level guidelines and unable to pay minimal rates. And since we're a nonprofit, our services are not covered through health insurance or through Medicare reimbursements. However, no client is denied the ability to seek our services if they need us. And so to eliminate as many barriers as we possibly can and ensure that our services are available to as many women as we can who are experiencing financial difficulty, the Judson Hickey Center has established a program, our financial assistance program, to assist those that have financial needs. So clients who are able to pay a portion of our service costs are expected to do so, of course, and the remaining balance will be offset through this particular program. And our action plan for this program and for this particular grant that we are seeking, if we are awarding it, is very specific to provide financial assistance to approximately 10 to 12 women who are low income, who may need some assistance in this area, and of course to provide more hours of service to them so we don't have to limit their hours if they come to us in need. And of course expand just the outreach in general to more women in this community who need the services at the Judson Hickey Center for Alzheimer's care. Our fees, since they are based on the individual's income, not the caregiver's income, so the affordability of the Day Center, which is supported through this financial assistance program, is certainly a tremendous asset, and hopefully making it possible for as many families to utilize the Judge C. Hickey Center as a resource for their loved one as they can. And I can speak from experience here. My mother is a client at the Judge C. Hickey Center. She was diagnosed several years ago. She's in the advanced stages of Alzheimer's now, and she's been a client at the Judge C. Hickey Center for over 5 years. And since it has been an affordable alternative for her, it's been a blessing, not only to her, but for us beyond belief. And it's kind of hard to put a price on the comfort and the peace that our family has felt by having such a unique and loving and nurturing environment for her to stay as active as she possibly can for as long as she has been able to. It has really provided just an enhanced quality of life for her and increased her social interaction, of course, but it's certainly a place where she has been appreciated and that she has been cherished, and so that has just been so meaningful to us. Our financial assistance program is an ongoing project at the Judson C. Hickey Center, and our goals are, of course, to continue to maintain this program for individuals who may need some extra help, and to expand our outreach to others who may need it as well, so they can certainly take advantage of this wonderful resource in our community. So really, on behalf of the Judson C. Hickey Center and the Board of Directors, I just want to thank you for having me here today to talk a little bit about what we do, and for your consideration of our grant application. We're certainly humbled by that, and maybe just appreciate your time here today, and I'm happy to answer any questions for anybody if you have any, to the best of my ability.
Jan, could I just let you restate, the fees depend on the client's income, not the family's income, and the percentage of those that do receive assistance because of low income? Just ballpark, not
the majority of them do. We are supplemented through the state, the state funds, of course, through the Area Agency on Aging. but that doesn't cover all of the fees. And some clients, they have the ability to pay, but if they don't, or if they can't, or if they can even not afford even the minimal rates, we don't turn them away. We try to find an avenue for them to be able to participate.
Good. Thank you.
And so the majority of the clients are in that situation. All right. Well, thank you so much. Appreciate your time. Thank you.
Good afternoon. Thank you very much for the invitation to be here this afternoon. I'm Ron Skeens from Christ Community Health Services. This is Jeff Drake over here, our Executive Director. And I'd like to say first, thank you for your support in the past. We received a grant from Women in Philanthropy a couple of years ago to support one of our nurse practitioners whose specialty is women's health. So we truly appreciate your support in the past and appreciate the chance to come and share with you today what we're doing at Christ Community Health Services. We operate 2 primary care health centers or clinics in the downtown community. One is in the historic Widows Home in the Old Town community, and the other is in the Laney Walker community on Datnack Street, right across from University Hospital. Our patient base is adults and children with limited access to affordable care. We opened in November of 2007, and our current staff consists of 6 physicians, 2 nurse practitioners, and 1 physician assistant. And these are on our staff. These folks, this is their practice. This is not something they're doing as volunteers or doing on the side. This is their practice. And they're young, energetic medical professionals who are truly trying to care for those in our community who have limited access to health care. In addition to that, we've got about 35 paid staff. So it's amazing. 5 years ago, in November 2007, we had 2 physicians, 1 nurse, and 1 person answering the phone, and 4 exam rooms. Fast forward 5 years, and we've got 2 locations, 22 exam rooms, 9 providers, and 35 staff. So the organization has grown tremendously, which I think reflects the need within our community for affordable health care. Our providers are certified in family medicine, internal medicine, pediatrics. As I mentioned, the nurse practitioner that you funded a few years ago, her specialty, as I said, is women's health. We do some cardiac care. We have some folks from MCG coming over once a week to do physical therapy for our patients, and we refer out to specialists as needed. Our basic expertise is primary care for folks in our community. Most of our patients, well over half of them, have no insurance. They are self-pay, uninsured folks. They have families, they have jobs, they're working in our community. They simply can't afford health care, or their employer's not offering it. So that is the majority of our patients. They're seen on a sliding fee scale. It starts at $25 for an office visit and goes up from there based on household income. We saw almost 13,800 patient encounters in 2012. And since opening in 2007, we've logged more than 46,000 patient encounters. And about 65% of our patient base is women. So that's a snapshot of our overall organization. We are a faith-based organization. Our mission is sharing the love of Christ through healthcare. And that's what motivates us. But I also like to point out that that doesn't imply any kind of restrictions or screens or prerequisites to anybody coming to us for care. Our doors are wide open for anyone in our community that needs affordable health care. There are no barriers to folks coming to see us. The project that we've come to you for is health care for homeless women in our community and women in transition. Between November of 2011 and November of 2012, we had about 300 patient encounters for those in our community who are homeless. This is something that we're already doing. Most of them were referred from Safe Homes, from Hope House, from the Salvation Army, from the various great agencies in our community who are already serving those folks, who are facing enough challenges as it is without having to worry about their health care. So we are coming to you requesting money for women who are in these situations being served by these agencies, that we can provide them health care. The funding, should you choose to provide it for us, would cover about 140 to 150 visits for women in these situations over the course of the next year. It would cover their basic exams, labs, any kind of diagnostic procedures that were required by that. And all of our providers would be involved in this. Mrs. Driver, our nurse practitioner, would focus on it, but all of our providers would be involved in this. And this is something that our founding physicians, Dr. Grant Scarborough and Dr. Robert Campbell, had on their hearts from the very beginning. We have provided health care for the homeless in our community at no charge from the very beginning. So we would hit the ground running with this. This is not a startup project. There are no policies and procedures to put into place. Should you choose to fund this for us, we could go to, we're already doing this, and you would just be helping us underwrite the expenses. We absorbed about $50,000 worth of health care for the homeless last year. So we're asking for some help from Women in Philanthropy to underwrite some of these services that we're providing to those in our community. We would reach out proactively to these organizations that we're already informally working with and be able to go proactively to them and say, here's what we have now, here's what we can offer for you. And we have, thanks to the beauty of electronic medical records, we have very detailed reports that we can generate for you. I know that's something that you're interested in. We could provide you with accounts of details of how we've used your investment in us at the end of the year as you would ask us to. So thank you again for the support you've given us in the past. Thank you for the opportunity to be here this afternoon, and we really appreciate what you're doing in the community. I think this is such a great concept for you to all come together and look at these organizations and see who it is you can support in the community. I commend you for that. I think it's great work that you're doing, and we're very pleased to be a part of it, and thank you for your time this afternoon. Questions? All right. Thank you.
Thank you. Okay.
This is not Promises, Family Promise. This is Rape Crisis. Sarah has graciously allowed us to sort of jump in a little bit early. My name is Annie Henry, and I'm the Director of Rape Crisis and Sexual Assault Services, which is based at University Hospital. And Jenny Lindsay, who's one of our therapists at Rape Crisis. And so, you know, I know many of y'all, and I'm very humble and grateful for the opportunity to come back before you to, you know, to seek some additional, you know, to continue support. We've been very fortunate that Women in Philanthropy has funded us for our project, and so we're here today asking for a continuation, you know, of that funding. You know, Rape Crisis was formed in 1975, and you know, we've been in the community for a number of years, you know, providing services to women and children. And we are based at University Hospital, but we are a community program, and so we do provide services throughout this community at all hospitals in a number of counties, you know, which represents 3 different judicial circuits. You know, certainly our mission at Rape Crisis is to provide very quality, efficient, and culturally competent crisis intervention and advocacy and therapy and prevention education to children and women. And Safe Homes, also, who is a collaborative partner with us in this proposal, that their mission is transforming victims of domestic violence into survivors. So the Women in Philanthropy grant would allow us to continue to provide that very specialized individual counseling and therapeutic support for the women and girls and children who are survivors of sexual violence and or interpersonal violence, and that are seen both at Rape Crisis and at Safe Homes. Safe Homes and Rape Crisis obviously have worked collaboratively for many years.
that we've come together, and this is for 2 years on this special project. And that we are at Red Crisis the administrative manager of the grant, so that we can make sure that quality assurance activities are in place and that there's the evaluation oversight. And so what we want to do is to be able to continue to provide that collaborative support and providing free, very, very specialized individual counseling and therapeutic support groups for these women and children, have experienced, sexual trauma or interpersonal violence. One of the things that we have is very obvious to us in working with safe homes for these years is that 100% of the women who are at safe homes also have a personal history of sexual trauma. So the funding supports 2 therapists. One is Jenny, and then who's a marriage and family therapist, and the second is a master's in social work who is also very specialized as a registered play therapist. And so they're providing both individual and group therapy to these individuals. And it's a very specialized, very multi-component treatment for persons. It was developed for persons who are suffering from PTSD and depression. And that by our collaborative efforts, then availability and access to those specialized services certainly has increased. It is provided in multiple sessions, individual multiple sessions. Also, the group is multiple sessions. The reason why we need to go early is that Jenny has a 5 o'clock client, as well as needs to get on to do the Safe Homes therapeutic support group. And certainly, the goals of therapy is really to improve people's sense of self, the confidence that they have, and to be able to function in life, in a successful way, and to productively cope with the stresses that they're experiencing. I think that at Rape Crisis that and for Safe Home clients, there is no charge, for the services that we're providing them. And it's not limited to those persons who are just in shelter or just have experienced sexual assault. There are many people who come who have had a long history of, childhood sexual assault, and so they're now ready, to be able to work on that. And so we want to be able to provide, help them, develop skills and to really process that trauma. One of the things that I think that we are able to do in this year, and Jenny's going to talk more about that, is our ability in this work is for the clients to really gain some stability in their life, and to feel safe and to acquire those skills that they need. And particularly for families, for women with children, is to understand how the trauma that they experience, like with the interpersonal violence, is how that affects their children. Because we certainly, Rape Crisis and Safe Homes is all about dealing with the crisis at hand, but another very important part of the work we do is prevention. And we do want to be able to help this community prevent sexual violence from occurring in the first place. There is absolutely no reason for it to be in our culture. Every day we're reminded in our media every single day of the sexual trauma that people experience in our community as well as in the world. You want to talk about your work?
I just wanted to say a few words about this project that you all have funded for us over the past year. It's been really exciting because I feel like it's been really effective at reaching a large number of women for the small staff that we have. And the group and the individual has really worked well together. We get referrals from all over the community, all over the area for children, adults, families who have been affected by sexual violence, and I'm able to provide counseling for them at no charge. I do this group, and the women are excited about this group, and it's kind of an introduction to therapy for some of them, who've never had that experience. And then I can say, oh, and Donna Lewis can see you for individual counseling if this was something that was helpful to you. And they call her up, and they see her for individual. And then we just have a really nice network of kind of reaching out to a large number of women and families, children that have been affected by sexual violence. And it works so well because it's a really difficult thing to ask for help for. When there have been times that our caseloads are too full or we just can't take more clients, we really hate to have to refer people out because it's so hard to pick up the phone the first time, and people are so relieved when we say, yes, we can see you next week, and you know, there's no charge, and we can talk about how long you need to be here. We're also able to do, between Donna and myself, a lot of just really basic case management for people who are getting back on their feet. We don't have financial resources to help them ourselves, but we're able to connect them with other partners in the community, and just, I think people just really feel empowered, and they feel that this is okay to talk about, and this, you know, we are people who can help them, and particularly with group, letting these women be in that situation together, so that those who are kind of a little bit further down the path can really help those who have just come into the shelter. So the project has been really effective, and it's been exciting, I think, for a lot of us. And just, we feel like we're really able to serve this population that that has such a high need for services. And we really appreciate your help with that, because it's been really fun to be part of that, and feel like you're really making a difference for people, which is, you know, not always the case, but it's really nice when that is able to happen.
Any questions? Yes, ma'am.
Do the women, how long do they remain at the center?
Well, women who are in safe homes in shelter, that's around 30 days. As far as in therapy, we can be very flexible. Usually it's about 6 months. In some cases it is a year. In some cases it's 2 or 3 months. So as far as counseling, it's pretty flexible. And as far as the shelter, they're in residence there for about 30 days.
And even after they leave shelter, they can continue, you know, with therapy, both at an individual level or at group. So we try very hard not to have any barriers. All of the therapeutic services are delivered at our office at Rape Crisis. Safe Homes has not had funding, you know, other than through women, you know, through this collaborative with Rape Crisis for many years to provide a therapist. And so this was an unmet need in our community, and so Women in Philanthropy, you know, stepped in to help us be able to work together, you know, to be able to meet the needs. I mean, we really do see women who are committed, you know, to coming, and they are doing much, much better in their life, and, you know, and getting whole and being, you know, much more healthy, and being, you know, continuing to have, you know, go out and have productive lives. Yes, ma'am.
How have you been able to measure your outcomes? How do you know when you're successful?
We, as far as my individual clients, I have, I do cognitive processing therapy, which involves a PTSD scale that they fill out, you know, how many of these are problems for you, how severe. It's kind of a 1 through 5, so it's a very kind of concrete, how does it seem like you're doing? And so we do that every 2 to 3 weeks throughout the course of therapy. And then at the end, we kind of look at, here's where you started, here's where you were halfway, and here's where you are now. And 100% of my clients who are able to continue to come and who are consistent in attending have had some degree of resolution of symptoms, and that includes some of my clients who have pretty significant mental health issues. You know, they aren't going to feel as much better, but they see, you know, meaningful improvements in their trauma symptoms, and so that's been a real helpful for me and for them to kind of look at this kind of concrete scale about here's how my symptoms are better and here's where I was 3 months ago.
And Rape Crisis does have a very formal quality assurance process that we go through. So we do
we have satisfaction surveys that are anonymous for anyone who's been in therapy for more than, you know, a few sessions that we do.
So, you know, we work on those, you know, every staff person is working on different aspects of it, and so, you know, we do quarterly formal reviews and reports, and then annual. So we do have a very detailed, you know, instruments and measures of trying to look at our outcomes and make sure that we're, you know, doing what we need to do. And if there are barriers that arise, then we are able to address those. Amy and I are on speed dial, you know, on our cell phones. So, yes, we have representation from Safe Homes, and we are just. We're just very grateful, you know, to be able to have been able to do this for the past year, and so we humbly, you know, are seeking, you know, the support from you one more year to be able to continue to provide therapeutic services. Thank you. Thank you.